All right, good morning, folks. Thank you for joining us today. Today is October 31st, 2025. It is Halloween. Thank you for joining us at Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. Great to see so many of you here today. We've got 54 folks logged on so far. For today, let me do some introductions of staff and then we'll get into our agenda. So we have Michael Mercado from our Community Services Department. We have our manager, Michelle. Good morning. From Client Services, we have Carol Wilhelm, Client Services Manager. Good morning. Additionally, from Community Services, we have Jaslyn and we have Christine and we have Odelia joining us from a beautiful backyard scenery, which I absolutely recommend for those of you that work remotely on certain days. And good morning. I see Deanne and Marty and our employment specialist, Carly, on. Good morning from Community Services. We also have Tom and Jessica on, Shauna as well, and Allison on from Community Services. We've got our manager, Scott Barr from our QA unit. Good morning, Scott. We've also got Sammy Lynn on and Jolana from Community Services. Additionally, I see Alejandra and I see Mason and I see Kylie and I see Beverly and Alicia as well from Community Services. Good morning. We've got Christy Schaefer on. We've got Jordan Eller, our Specialized Services and Supports Manager, who I'm going to make a co-host right now so she can talk about stuff later. We've got our manager, Helen from Community Services, and the ever faithful Zach, my assistant, on as well. All right, folks. We have I think a pretty cool agenda today. We are going to have our Deaf Culture 101 and our sign of the week with Michael. I hope everyone remembers Monster from last time. And we're going to do a presentation by Michelle Duchesne about the Quality Incentive Program. There's been some webinars that have gone on, and so we're trying to give as much early information to you all as we possibly can. We're going to do a little plug for our upcoming Provider Advisory Committee meetings as well. I'm going to share some information about that. We're going to get a presentation, probably about 7 minutes or so from Shift Care, giving an update on what's going on with them, as well as an offer that they have for you as service providers as well to get involved with working with them. We also are going to have some updates from Jordan, I guess a few updates from Jordan. We're going to get an update on the new ARFPSHN rates, what the status is with the level 7 residential rates. We're going to talk about our CRDP request for proposal. There's a substance use disorder training that you guys heard about last week from Dr. Eldridge that we're going to be talking about again too. I believe we're going to have from Client Services on Ms. Jennifer Bloom, and we're actually going to make her a co-host. But Jennifer, I can share the screen with the information from our website later if you'd like.
Thank you, John. Can I make a quick request?
Yeah. Yes.
I have to log off to another meeting at 11:30. So if I could weave in there somewhere, I would love it.
We're going to weave in real quickly here, and then just one second. We're going to do our very best. Many of our staff attended a training about standardized vendorization yesterday from the Department of Developmental Services. And so I guess we're going to do our best to give you all a little bit of an update about what the status of that is. And then I had an opportunity to present at a supported decision-making symposium this week. And there was a little bit of a challenge that was laid out there about supported decision-making and service providers. So if we have time, I'll touch bases with you guys about that a little bit too. So with that, actually, I'm going to throw it to Jennifer Bloom next, and I'm going to share my screen, I believe, Jennifer, with our website, right? With our events calendar.
Events calendar, yes. Very good. Thank you. So each week leading up to this board meeting on November 20th, we're going to be here at Coffee with Community Services, updating and inviting your attendance and feedback at our board meeting, November 20th. And registration is required. There is a link right here on the screen that John has up here. It's from 5 to 7 p.m. And this is a public meeting. So we're going to be discussing two things. One is the National Core Indicator survey results, and the other is the year-end performance contract. So every year, we're required to present these 2 topics at a public meeting, and we're using our board meeting forum to do this. The NCI, National Core Indicator Survey, gives us great information about the services that our clients are receiving, what type of access they have to the community, just their thoughts about being able to reach their service coordinator to get services in their preferred language, all types of concepts. And so there's a child survey that is completed by caregivers. There is here's the description of all the different surveys. We're also going to review the results from the adult in-person survey. And this is a face-to-face interview with the individual who is 18 years and older and receives one service from the regional center in addition to case management. The child family survey, of course, is completed by the family of a child aged 3 to 17. And then we have the family guardian survey. And this is completed by families and conservators whose loved one lives in a community placement setting and gets at least one service from the regional center in addition to case management. So what John's showing you here are the results from all of the surveys. And let's see. If you go, we're requesting feedback. So
Yes.
this is an opportunity for us to get your feedback on, so once you attend the meeting or you review the results on your own, we have a dedicated email box, NCI feedback@altaregional.org, and we're accepting feedback until November 28th. The reason we have a cutoff date is because we are submitting a report to the Department of Developmental Services, letting them know what feedback we received and how we plan to implement the feedback to improve our results. Okay, next, part 2 of this meeting will be our annual year-end performance contract data meeting. And this meeting will discuss results about the way that the regional center complies with DDS standards, where our clients live, where they work, how we're addressing disparities, and more. So this is another opportunity to listen and just provide your feedback and input about how we're doing and what ideas you have for us to improve. We're constantly looking to improve, and your feedback is important. And John is showing you the very tiny writing, but this is the report here. John, could you scroll up just a tad? Thank you for navigating. Okay, so what I wanted to point out here is that the year-end performance contract data is based on public policy measures that we don't get to determine. These are public policy measures that are determined by the department. And then we look at our baseline data and we compare it to state data. And so sometimes it's better if our percentage is higher. Sometimes it's better if our percentage is lower. It just depends on the measure. And we're going to be giving an overview, because this is a lot of information. We're going to be giving an overview of this data on November 20th at the public meeting. So feel free to review it ahead of time if you'd like, because if you can't attend or you want some more time to absorb, it's a great way to do that. Thanks, John.
Excellent. Thank you very much. Again, you can see on our website that you can navigate to all the information that will prepare you to understand what's going on in those meetings. I am now going to spotlight Michael Mercado and have him do our Deaf Culture 101 and Sign of the Week.
Hello. I know some people saw my outfit. They might know what I am. Some might not. I am a steampunk. So I'm a little relieved I can see some of you in other costumes. I was hoping that I wasn't the only one. So I normally have 3 signs. I actually added a 4th. Last year, I taught the sign for Happy Halloween, and I wanted to review that again. So we'll do that first. So we have happy and then Halloween. Happy Halloween. So now for this week's signs, we have horror movie, dark, and hyperventilate. Okay, so for our first one, so horror is like this. So and then you're going to use your dominant hand in a 5, set it like this, and you're going to wiggle it back and forth. So this is movie. So when you put those together, you have horror movie. Yeah, anyone love horror movies? Our second word is dark. So we have our 5 hands and they go across our face for dark. And then third will be hyperventilate. So it obviously has to do with our breathing. So breath is slow, but now we want to do it a little quicker. And that's going to show hyperventilating. So you show it on your face, you show it with the speed of the movement. So we'll review those. So we have Happy Halloween. We have horror movie. And then we have dark and hyperventilate. Last day for Halloween signs. So if you want more, ask again next year. So now for Deaf Culture 101. Is taking an ASL class enough? So that's what we're going to discuss. Oftentimes people will take ASL 1, 2, and 3, maybe while they're in high school or as a college class. ASL classes will teach you how to sign words and will teach you language structure and communication. But these classes are not going to show what it means to be deaf or the culture at all. So ASL classes really don't teach you about deaf culture at all. So where can you learn that? There's a few options. You could do deaf studies or a deaf culture class. Lots of colleges will offer these classes or workshops. Deaf documentaries will really talk in depth about deaf culture, what it involves, the really richness of the culture, the history. And it'll really go more in depth than just basic sign language. Also, it can help you to really see what deaf and hard of hearing individuals' daily life looks like, what those barriers might be. So, for example, not being provided an interpreter or a video that doesn't have captions, a workspace that might not be accessible, and what those barriers might be. So this can be really beneficial for those who may struggle to learn American Sign Language. They might feel it's hard to communicate, or they feel they might be unable to learn a new language. That's all right, because if you take advantage of studying deaf studies or deaf culture, you don't have to know ASL to take those classes, but it can give us more knowledge about understanding really what deaf individuals experience, like deaf pride, deaf identity, again, those barriers, lots of different topics that are even just culturally about how to be direct, eye contact, how we rely on visuals, not auditory signals. As you learn those things, you can kind of think about what your barriers are as well, and it can help you to better understand how to make your space friendly and welcoming and accessible. And it can also help you to educate others as well. So for example, previously I gave a presentation about nonverbal individuals. So before deaf individuals who didn't speak would be called mute, but that's not nonverbal. They use sign language as communication, and that is still being verbal. So making sure that we support and educate others as you learn these things and you see another hearing person maybe use a term, you can educate them, and that can be really an ally for the deaf community. So again, ASL classes and deaf studies or deaf culture classes, documentaries. For example, Deaf President Now on Apple TV is a good documentary. Take advantage of these resources. They all really strongly represent deaf culture. And as you learn more about deaf culture and deaf individuals, if you end up having a deaf consumer in your program, or you work with deaf people or interact with them, I encourage you to maybe take a workshop or watch a presentation. DDS provides presentations about deaf individuals with developmental disabilities that are very valuable. There was just a presentation on individuals who are deaf and blind, how to identify that early loss, how to support them and provide resources. Another presentation focused on being deaf and also having autism. And these can really be beneficial and help us to understand how to interact with different individuals. Thank you so much.
Excellent. Thank you, Michael. All right. I wanted to actually just spend a moment here, and Jennifer Bloom is on, one of our directors of client services, and I don't know if we have any of our client advocates on right now, but supported decision making, Jennifer Bloom, something that when I was a brand new staff at the regional center, it was taught during our 2-week long ACRCU, and over the years when I was at working out at Sonoma Developmental Center with so many conserved individuals, looking at what are the ways where we can support individuals to be able to be part of a team that is making decisions, as opposed to having certain rights taken away. And we did our coordinated future planning initiative at our regional center, and within that, we had Kelsey Hancock, who is our Office of Clients' Rights Advocate representative, who presented in those trainings to our service coordinators about supported decision making and how that really aligns with it. But I was at this conference on Monday, and there was thought that maybe there needs to be more outreach specifically to service providers about supported decision making. Also, there was some feedback about in planning team meetings sometimes with service providers that sometimes for individuals that certainly have lots of medical or behavioral support needs or challenges, there may not be as much knowledge about the range of different options. And so just for this group and like what we have here, we've got some experts that know about supported decision making at our regional center. And I was just thinking maybe we could look at doing we don't have to do all 33 slides of that very awesome presentation that we have online. But I think for this group, is that something that folks might be interested in, is hearing a little bit about supported decision making, talking about conservatorship? Again, because you guys play such a vital role within the planning teams, I feel like the feedback that I got was that we need to do a little bit more education to service providers so that they're aware of it as well. So in the future here, we're going to be looking at bringing in, more like education opportunities for service providers. And so Jennifer, maybe we can connect with some folks that are kind of part of that training team, because I know there was a training that just went on in Woodland or something too. We did our own one just this week, right?
Yes, and Reva has been participating with Michelle and David Lopez. So and we've also done like shorter scale, to your point about not needing to do the whole thing. We've done more condensed versions to school districts. It's helpful information for them to have as well as they're talking to students getting ready to transition into adulthood, just to understand that supported decision making is in law, and it is an alternative to conservatorship or other methods that we've known in the past. And it's really supportive in the name, but also just really allowing the client to make their own choices about who they want to help them make decisions. So that's the whole concept. And
Yeah.
it's about writing it down and developing a plan. And it's a legal method to do that without going through the conservatorship process, which is really taking away someone's rights.
We do have some amazing materials on our website. We have, and it's translated in all different languages as well. Maybe we can, if a staff wants to drop that in the chat for folks to take a look at that. But I would like to kind of bring that discussion to this group. I think even going over the supported decision-making agreement, so folks understand like what is the document that we have that kind of outlines this as well. So I'll work with you guys on as part of that team because I'd love to hear from the client advocates, and my staff are always looking for opportunities to bring in folks that can provide some additional training to our service providers. So thank you guys. I felt like there's very good feedback at that conference that we need to be mindful of educating service providers as well so that they are fully aware of it. So I know it does come up during our new vendor orientation. It is a discussion. That's why we always had David Lopez involved in those as well. So, all right, I am now going to throw it to Michelle Duchesne, and I am going to share my screen, Michelle, and let you navigate us through this discussion. So let me share real quickly. And thank you very much, Jennifer, for all that information.
All right. I'm waiting for it to come up. Okay. So thank you, John, for sharing that. So I'm not sure how many people were able to attend the QIP meetings that DDS put on. I know some were kind of rescheduled. So what we've done here is just created just an easy infographic for you on just the overview of what it's looking like for our quality incentive for the following fiscal year. So I'll go over these a little bit. There's some links down there to all the directives that you guys, John will put that in the chat that you guys can look at later. So this is regarding fiscal year for the QIP 26 and 27. So currently the fiscal year, the 10% that you guys have earned is through the end of this fiscal year. So to earn the 26-27 fiscal year, this is kind of the next steps for that. The department has let us know. So these are surveys that are going to be sent out through the provider directory that you guys all should be a part of. And those will be sent out. The department has let us know they will be sending those out on Monday. So November 3rd, those will go out to the email that's in the that you've identified in the provider directory. This is required for providers who have billed POS, so services provided for the terms from January 2024 to June of 2025. So if you were vendored in July of 2025, you will receive a separate survey. The department has not identified what exactly is in that survey. But if you're in that group that's vendored after July of this year, you will receive a different survey than the ones that we're going to go over. So if you'll scroll down a little bit for me, John. So provider capacity, this will require providers to answer questions regarding the zip codes and areas that they serve, languages offered, the vacancies they currently have. There's also a breakdown of the staff wages, the length of time with an agency, the number of staff who have left the agency, and number of part-time staff and full-time employees. All of these webinars that I'm going over with this information will be uploaded into the website for DDS, but it does take a little while. So we just wanted to pull this together for you. The department did also go through step by step each one of these and what that looks like for what you're going to be completing. So they went in and did a test case and walked through all of those pieces. So once you guys receive these, I'm anticipating that they will be uploading these webinars when they send those emails out so providers can start looking at that and getting that support. If you can scroll down a little bit, John. The other two surveys are prevention and wellness. So you'll see the service codes noted there. We have also a link down below that breaks down all the service codes. I'll ask John to click on when we're done. So this is to gather information that measures and you guys are just tracking as far as preventative health screenings for adults and children living in eligible residential facilities and homes. So it breaks down what exactly is required for each type of home, a children's or adult, and you'll have to attest to that in their survey. So employment services are for service code 950 and 952. The questions you're going to be connecting and inputting there are the staff who directly support clients. So it is very detailed. So they are requiring names of staff and breakdown of all of their information that they're supporting. So if you identify and you have 50, 60 staff, they are going to request the names and all the information for those. So please be ready to spend some time on those surveys. If you're a bigger agency, the department is allowing through the end of January to complete these surveys. So they've let us know that they will be checking on compliance effective February 2026. Also in the employment survey, they will be asking you to list staff that are ACRE certified or CESP training certified. They have noted too, it doesn't mean that you have to have all your staff certified. You are just attesting to the ones that you do have. So it's, again, just survey information. It doesn't mean that if you have staff that are not ACRE trained, that you will not receive the QIP. I know that was some feedback as well. It's just gathering information. Reporting clients in PIP, group employment, and also a total number of jobs that each client has had. They've even requested start date and end dates. Again, it's very detailed. There is, if the client is continuing, you can say present and ongoing. And also anyone that's transitioned from a PIP to a CIE, they're asking for that detailed information as well. Can you scroll down a little for me, John? Again, that is just letting you know anyone vendored under 6 or after 6:30 will receive a separate survey. And then additional QIP requirements. So providers must be compliant with our electronic verification, the HCBS, excuse me, so many acronyms, and the independent audit. So DDS will verify the vendor numbers for the independent audit. So if you were required to have that, they will be checking that February 27th of 2026. That's what they've identified. Down below are resources for you guys. So if you are interested to know if your service code is required to have EVV, please select that. That'll break down what that looks like. It'll tell you the service codes that are required to have that. There's also an exemption process that if you click on the additional piece, it will show you how to do that as well.
Whoop, I lost my screen there.
I think it's the PDF, John.
There we go.
There we go.
And
Eligible service codes is something else the department shared with us. So this breaks down service codes that require what survey. Now you'll see on there that 048 and 055, those are services that are no longer part of the rate reform. However, because this is a survey that is back through 2024, the January 2024 till June of 2025, you will be, if you were operating as an 055 in those years, those are the surveys that you're required to have. So you can scroll through that and go through your service code, and you'll see right there for the 096s, they are going to be required to do 2 surveys. One thing to note with this as well is the department for the fiscal year 26-27 has identified that there is a 90% of the rate, a 95% of the rate, and 100% of the rate. So you will see there for 920s for residential facilities serving children, a staff operated, you have 2 surveys to complete. If you only complete one, you will only receive 95% of the rate. So please be sure to note that and complete both so you can get the full 100%. And then John, if you want to go back again, these are the links that we just, or excuse me, the directives for the QIP, the provider capacity, the prevention of wellness, employment, and that EVV, HCBS, and audit requirements. So you guys can review in detail really what the measure is looking for on that as well. I don't know if anyone has, we'll share that with you guys. Is there any questions?
I would be interested in if anyone has different information. I believe our understanding is that you must comply with those independent audits. You must comply with the, if applicable, the EVV, if applicable. You have to foundationally do those things first, the HCBS compliance, those 3 things first. And then on top of those things, that's when you are doing these additional ones as well. So let's say you do the survey, let's say you do the survey for capacity, let's say you're a residential provider and you do the prevention and wellness one as well. If you're not HCBS compliant, I don't believe that I think you're going to be at 90%. And so I don't know if someone wants to unmute themselves and if they believe anything differently, but I believe that's the threshold is you can get that 90%, but that if, in order to get the full 100%, you have to do those 3 compliance things in addition to these, measures that Michelle just shared. So we're in a phase right now. We all know that this does not begin until 2026, till July of 2026. So this is just us pushing the information out to you, making sure that you all know where to find the resources. And then just like the previous QIPs, we have no interest whatsoever in you guys not getting your full rates, because the benchmark rates were based off of what your costs were as they were like reported, not based off of like 90% of what your costs were. So we recognize that it's a hardship. It's also a hardship because many of you are at 100% right now. And if you're not in compliance after July 1 with these new measures, then we're going to have to lower those rates, which is operationally very challenging on our end, and certainly not something that we want to do. So we're going to make sure that everyone gets the support that they need to get their QIPs taken care of. Yeah, Andrew.
Sorry, trying to unmute. I had a question about the EVV compliance threshold. Except I think it's just that we are like signed up for it, but is it our regional center that has to approve or like verify that? Or I'm a little confused of how that happens, I guess. I mean, we are signed up and we're doing it, but
I believe that we have access to the information of, right, Michelle?
Yeah, I believe that Kylie and Scott have worked with the providers that are required to have it. And we've reported that to the department. So they have service codes that are required and vendor numbers. So they will be reviewing that and reaching out to us if they need any additional information.
so we have it and we have not heard anything, so we are good.
Well, so this is starting for, just keep in mind the surveys and all of this stuff is starting, and
Like
please.
next week.
Yeah, so Monday. And so
Okay.
please get the surveys done. Please get, like I said, the department will be reviewing those effective February. So please make sure even though the fiscal year doesn't start until July, please get these surveys done because they will be doing that. EVV is another one. The department, my understanding is the same deadline. They will be looking for providers that were required to do the financial audit. They'll be looking for the EVV requirement as well to see. So like I said, though, Scott and Kylie, they were the ones that worked with the EVV stuff. So if you have any further questions or need them to look into that, please send Scott an email, and then we can definitely look into what we have for you.
Thank you.
Awesome. Again, we're just going to keep providing you all this information as we get more updates. We want to really encourage each of you to get on to the Department of Developmental Services website. I believe we're going to try to send out this infographic document here to MailChimp to all of our people that are signed up. And so follow the links that are in there, go to DDS's website. And again, we're going to keep you updated between now and 8 months from now, or 9 months from now on people's compliance opportunities. Let's see. I am now going to throw it over to Kyle from Shift Care. Kyle, take it away, sir.
Amazing. Sounds good. Hello, everyone. I may not be a familiar face, but Shift Care may be a familiar name to some of you. I know that we had spoken with your team earlier this year. I think, John, was it way back now in January already? We're at the end of the year almost, which is pretty
Sounds
crazy.
about right, yeah.
That far. But yeah, we're just going to do a quick highlight on some of the changes Shift Care has been making. We work with a lot of regional center service providers across different regional centers in the state. And so our goal is really to hopefully enable a lot of the businesses that we bump into running smoother and more effective organizations. We recognize that you're doing a lot every single day. We're hearing about things with EVV compliance coming up and changes. And we recognize that that's just one of many moving parts in your organization. So quickly, do a quick agenda. Like John said, this will be pretty brief, probably 5-7 minutes of just highlighting some changes since we had met with your teams last in January. A bit about Shift Care for those who haven't seen us before. And then, like John had alluded to, we do have an exciting custom offer. We're really trying to invest in the community and increase the standard of care that we're seeing across the country. And so we just wanted to touch on what that would look like really quickly. ShiftCare is a global organization. We in the United States focus largely on California at the moment, just because we found that regional centers and the service providers with them click really well with our platform. So we've been able to work with just over 6,400 businesses globally, and have scheduled well over 100 hours within the platform at this point. We focus on a few things. You'll notice there's a lot going on the screen, of course, but we really try to work on that continuity of care, everything from scheduling all the way through to getting that data, say, into SanData so that you can get your hours submitted and reimbursed, and then everything in between when it comes to providing care for your staff and for your clients as well, of course. A couple of platform updates. A big one for us since we spoke with your team last was care plans. So this was something we took as far as feedback from a lot of people, potentially even in this room, who were asking for a easier way to manage tasks and ADLs and goal tracking within their clients. And so what we did was we went and built care plans within client profiles. And so what this does is, of course, we're able to track different goals against different focus areas, and we're able to see progress over time with those clients within our reports. And so as we update goal tracking or update tasks throughout shifts, we're able to see that improvement week over week or month over month. And I know that from what I've seen with a lot of businesses we're working with, this has removed a lot of manual sort of trying to keep track of client care, which is really exciting. Another thing we've released is our EVV reports. And so I know we were just talking about EVV. That's a big thing for a lot of people in the room, of course. And so with ShiftCare, because we're integrated with SanData for Medi-Cal, you're able to take your hours from all of the clock in and clock out for the shifts, all of the notes and the tasks. All of that gets pulled directly through an integration. And so there's no need to take a spreadsheet and copy and paste information into your portal manually so that you can get your hours submitted. We can also report on and track things like shifts that are in violation, as you can see, or shifts that are pending approval. So this has been something we've seen remove a lot of stress and frankly hair pulling from a lot of the businesses that we've been working with, which is really exciting. Another change is medication management. So this was being asked for quite a while. And so we've built medication plans within the platform where tasks and medication reminders can be associated for your caregivers. So they're able to check off on administration of medications during shifts. You're able to update these plans based on things that are changing with your clients. And this is a great way to keep this tracked within the platform instead of maybe having to use a separate system. And then one more thing we refreshed over the last year was our family portal. And so this is something we've been seeing used a lot with either families who are maybe we're providing care for the parents and the kids live out of town and the kids just want to know what's going on with their parents when we're providing them care. And so the family portal where we can share pictures and notes is a fantastic way to keep that continuity of care going. And then on the other side, we work with a lot of service providers who are working with young adults or even children. And of course, we know that their parents really would like to know what's going on with them when they're out and about, maybe in the community as well. And so this can be a fantastic way, again, to connect with those families and something we're really excited to see refreshed. So as you can see, there's a lot changing with ShiftCare, and it's all based on feedback from businesses like you. We work with thousands around the world, of course, like I mentioned before. And what we do is we really take that feedback and those requests for change, and we implement them within the platform. So things like that EVV report, for example, we were hearing that there was just a lot of friction with knowing, are my shifts compliant and in regulation before I'm sending them or submitting them? Or things like medication management. A lot of that I've seen done with pen and paper. Maybe some of you do that with pen and paper right now. And so what we've gone ahead and done as we've built this platform is we've started to really want to invest in the care community. So this program that we've launched with Alta California Regional Center is really exciting. You can see some of the information there. There's a QR code at the bottom, and I think a link might be thrown in the chat if you'd like to jump to where that QR code goes to. But essentially, we're actually offering the opportunity for members who'd like to modernize and implement ShiftCare to receive $2,000 to either support their own business or make a donation towards the Alta Regional Center if that's something they'd like to do with that money. And again, this is just us wanting to really invest in the community that we're supporting on one side, but ultimately we're a tool and you're the actual providers that are providing that care. And so this is us doing our best to do that. If this is something you're interested in, we'd love to chat further. Again, you can scan that QR code. We can connect online afterwards as well. And we'd love to speak further. So that's all I wanted to bring up was a quick
Cool.
update and an exciting offer. And we'll go from there.
Thank you. And so I will clarify, folks, you use the $2,000 however you choose
Yes,
to use
yes.
that funding. You guys know we don't accept donations. So so that being said, if this is something that you guys are interested in, you guys may remember that ShiftCare literally walked through our front door at our old office because they were at a conference across the street at the Hilton, and that's how they ended up kind of first getting connected with the regional center. Concurrently, we at the regional center are trying to do a lot as it relates to utilizing like smart technology solutions to solve, some of the challenges that we face in our industry. And increasingly, you as service providers being able to streamline any of your administrative type of things, because we know what we hear from all of you, which is that you want to increase the wages of your employees. That is where you want to be able to spend your money. You don't want to spend it on doing some of these other activities as well. So we're going to kind of continue to promote these types of things, but I did also want to make sure that I mentioned about the provider advisory committee at our regional center as well, that is promoting some kind of smart technology solutions during their meetings. I don't know if we have any provider advisory people on right now, but I was going to share my screen. I'm hoping that Kyle, you guys, maybe you can put your email address in the chat there, and you can drop your flyer in the chat if it'll let you as well. Otherwise, we can make sure it gets shared out to the group here too.
Absolutely. Yeah. And thanks for having us on again. We really enjoy chatting with everyone here. Yeah, we'll put emails in the chat and throw the link in there as well.
Yeah, thank you.
Of course.
All right. So I'm going to just share my screen real quickly. Every regional center has a provider advisory committee. It's something that's written into the Welfare and Institutions Code when it comes to regional centers. We have provider advisory committees that inform our board of directors, and we have plan advisory committee that informs our board of directors. Recently, one of the things that our provider advisory committee has kind of started to give space to is starting to talk about different types of technology solutions and the way that it can support, you all as service providers to, optimize and some of your tasks that you have to do. And so I just want to make sure I always am plugging participation in our provider advisory committee. We, consistently have a lot of people that attend these meetings, and it's very convenient on Fridays, and you can, log into YouTube as well and watch the videos. But being able to interact with like our executive management team and being able to have like the opportunity for like an in-person discussion with the community services managers or with like our executive director, I feel like it's very important. And so I know a lot of you have like over the years really put a lot of importance and consistently like attending provider advisory committee meetings. I just want to acknowledge that. Like I really appreciate that, and just want to encourage more of you. I will say certainly early start providers, if you were on here, we used to have more early start providers. We used to have more ABA vendors, the behaviorists that were part of our provider advisory committee. Residential providers, historically, we've had more residential providers that have been part of our provider advisory committee, and transportation providers too. Again, so I just want to encourage you across all the different service lines, think about like contributing to the regional center by like being influential to us through the provider advisory committee, and at least think about like logging in and participating in those. All right. I'm going to stop that sharing, and I am going to ask Jordan Eller to guide us through another few little topics here.
Okay, that sounds great. All right, folks, I'm going to share my screen so we can talk about the request for proposal that we have coming up next week on November 6th from it's Thursday afternoon. So this year, as you guys know, our community resource development plan really takes, we create that based on getting stakeholder feedback, right, of areas of need, looking at internal data and information we have to really see what are those important projects. So this year we did get startup funds for an advanced behavioral support home for children. We are targeting a little bit of a younger group with this. A lot of times our enhanced behavioral support homes are 12 to 17, and we do have an express need for specialized residential services for youth that are younger. So this will be for 7 to 12. This home is specifically going to be looking at supporting youth that may be transitioning back from out of state, right? Maybe they were placed out of state by a school district or a hospital or through CPS, and we are working on transitioning them back into the state. This will also be a support for youth that may have a history of sexualized behaviors or may have a history of that trauma and need support with eliminating those maladaptive behaviors. So we hope that you all will join us November 6th. I will drop this into the chat right now so you guys have the link to our website with the Zoom invite. We sent that out on MailChimp as well, but because it's just one project this year, we're looking, of course, for the Housing Development Organization to acquire the home, right, with those startup funds we got from DDS, and then looking for who the actual service provider be for that. So we hope to see you guys all there. John, I'm going to toggle to my next document. Are you now seeing a Word document?
I am.
Okay, cool. I will make it bigger. So we just wanted to give a friendly reminder. Those of you who were on last week, we had Dr. Lori Eldridge, who gave a brief presentation on substance use disorder and really why it's so important, right, in our service system for individuals with developmental disabilities. And then in the past, there really hasn't been evidence-based research, right? So her goal is really to help create evidence-based research, training materials, so the service providers and case management staff, right, that work with individuals with developmental disabilities can really support them, right? Not only understanding what is a substance use disorder, but what are appropriate ways to support them in trying to increase their motivation for sobriety, right? And what are some of those resources that might be available, right? Generic or vendor. So we only have 5 spots left. The training is going to be November 10th from 8:30 to 12:30. It's in person. We know that's a commitment, but this is a really important topic that we wanted to be able to present in person. There will, of course, be a lunch break from 11:30 to 12. It's going to be located here at the Alta office at our new location. I'm going to drop this information into the chat. So we really hope that 5 service providers are wanting to look at this train the trainer model, right? You only have to send 1 staff that would then have the ability to continue to train your DSPs within your program, right? Or management staff, whoever you guys send. So please do not hesitate to reach out to Virginia Gabby. We're actually going to be sending out another little notice to all of our providers that are signed up an email early next week, but we really want to fill the spots. This was a community resource development plan project that we got 2 years ago. It's limited funding, so this is our one shot, and we really want to get that room full so that we can have as many service providers educated about substance use disorders as possible. So let me drop a few things.
And real quickly, hey, Jordan, let me just check
Yeah.
the temperature of folks on this. Because I like to be a little interactive in our chat here, or at least a
Heck
thumbs
yeah.
up. We got about 80 folks on our show right now. So of the service providers that are on here, do we have some service providers that feel like knowing more about substance use disorder is helpful for the services that they provide to regional center clients? Like, is this a topic that you guys are interested in? Because we had a lot of providers 15 years ago that were really interested in this stuff, but we don't really have any kind of organizational champion providers identified that might we on our end can do our work, but we're really limited by not having service providers that are really interested in doing that. So we want to encourage that training, because the train the trainer model, if you have an interest, it will allow you to have a level of competency to be able to utilize it within your agency. And then our friend Aga from Westside Regional Center as well shared their materials as well for some of the online training. So I certainly recognized it a lot going on within some of the planning team dynamics and with clients and families. And so I just feel like, if I saw it on the regional center and in community services, it certainly goes on the service provider and day to day with, substance with services being delivered. Progressive, I see a hand up. Go ahead. Or is that an agreement hand?
Sorry, that was an accident.
Could not hear that. All right, let's see here. Real quickly, today is Halloween and programs are in session and tons of clients are getting services and some of you are dressed up. Zach Horch, my assistant, is going to drop his email in the chat right now. If you have Halloween photos from today from participants and you've got photo releases, we've got a newsletter that would love to feature pictures of what is going on today. So go spread some cheer with your lunches and all the things that you guys are doing. But if you could shoot us back over some pictures, we would love to focus on your agency and how you're embracing a fun day with the individuals that you serve. Jordan,
John,
what else
can
we
I-
got? Oh, sorry. Go ahead, Michelle.
I was wondering if I could share an image for a little inspiration. Michael,
Yes.
as you can see, is dressed up, and he let us know that it is his favorite holiday. So I wanted to share. Michael actually won our pumpkin decorating contest. His was definitely the scariest, so I wanted to share that with you guys. And Shauna got second place. So there's a little inspiration.
Right on.
Excellent.
Awesome.
The
Jordan, there's
one
some questions
thing-
in the chat about the
Oh.
training.
Yeah, let's see. Let me get the chat going here. Just one second.
Just is there interpretation available?
I think that we could still arrange that. We
Yeah.
have not yet had a participant that required that, but if that is something that would need, we could arrange that. So yes, we would love to be able to do that. I will get that set up.
That would be great. This is Rebecca. So do I
Okay.
just chat with you or chat with Michael? Who would I? who do I
Yeah,
chat?
you'll want to consult with Virginia Gabby. Her name
Okay.
is in the chat. You can include me as well. Let me put my name in the chat. And then I will also let Virginia Gabby know now, right? We'll get an interpreter scheduled. And due to the length of the time, I would assume, yeah, it'll be a couple interpreters that we would
Thank
need.
you.
Yes. Thank you so much, Rebecca. So
right.
John, the other thing that I just wanted to share with folks, right? So I know we generally do not have providers on that operate our adult residential facilities for people with special health care needs, right? That was a model that was created, I don't know, John, what, 7-8 years ago to be able to help relocate clients out of acute settings like skilled nursing facilities, right? And really be able to provide the nursing support they need in a home-like environment, right? To get some of these younger folks out of skilled nursing and give them a beautiful home-like environment where they have access to their RN or the LVN, right? 24/7. So this just is a testament to our service providers and the advocacy that they did for each other during during the rate study reform. So when we processed our acknowledgement forms for ARF push-ins, all of them were held harmless, right? All of them were going to be looking at a rate reduction. So they advocated with DDS. They asked for work groups across the state. ARF push-in providers got together. DDS was very open to hearing this information. I think their clinical team also really helped advocate, but they were able to get DDS to kind of see some of the areas of the rate formula that really needed to be modified in order to continue providing these ARF push-in services successfully after the held harmless timeframe was over. So in late August, DDS did create a new ARF push-in facility rate workbook, and we, Virginia Gabby and Norma Villareta, our lead, have been working really hard with our ARF push-in providers, and Toby Golden, our intensive case management supervisor, to really make sure that those new rates encompass all of the client's needs. And we are about ready to generate new acknowledgement forms for ARF push-in providers, and none of them will be held harmless. So I just wanted to share a positive story, a little silver lining, right, about the rate study, and just how it, what it goes to show that when vendors come together and, advocate, I was really happy that DDS was open to listening. And so we're really excited that our RF pushing providers will not be held harmless going into 2026. So thank you, John, for that time.
Awesome. I'm just gonna share one last thing. Are you guys seeing like a big group picture? Yeah.
Mhm.
I had an opportunity last week to speak at a conference in San Diego with a number of individuals, including the Lanterman Housing Alliance, California Affordable Housing Agency, ARCA, San Diego Regional Center was the one that co-hosted this conference with the California Policy Center for Intellectual and Developmental Disabilities. And we had presentations from San Andreas Regional Center, from San Diego Regional Center, and I was able to present as well. And again, there's a lot of very innovative things that we've been able to kind of get off the ground up in our area up here. Our HCBS team for the last at least 2 years, I think it was 2023, have been supporting the On My Own agency with developing the roommate matching app or roommate matching platform, that is now going to be transitioning statewide. We're doing that by having those services available through Housing Access Services that Dan Kilmer has really been instrumental in creating a statewide model that we can actually replicate for how Housing Access Services can work. And like, it really did not exist until Dan started working on it here at Alta. And now it's going to benefit all 21 regional centers because vendors are going to have a rate that actually works for them to provide the service and takes account for all of those having housing navigation activities. I had an opportunity to present. This is Jim Morgan, who frequently speaks at these events with us from the Department of Developmental Services and supports all of our multifamily housing developments. I wanted to just note this team here. Dee Dee from Jordan's team has been working really hard with Dr. Trivedi and getting Station MD vendored, which we're going to come and do some presentations for you all about Station MD, about how we are going to be incorporating that mobile emergency room telehealth service into opportunities for our clients. So he was able to talk about all the work that he is doing to get vendored at Alta during the conference. We had Vanessa Bull, who's part of our assistive technology pilot from East Bay Innovations, talked about our assistive technology pilot that we're doing. And India talked about how she uses her Ray-Ban Meta glasses to support her. She's visually impaired and utilizes them to support her both in employment and in her independent living. So I always get a lot out of attending these things, and I really appreciate these are the management staff from San Diego Regional Center that helped put it on. But just wanted to share that lots of amazing innovations like that we've gotten here and a lot of hard work put in by the staff within our community services department. And these are things that are going to benefit folks statewide, and it's coming very soon. These proposals for the new roommate matching service statewide that are enabled with support for individuals that utilize American Sign Language. The proposals are going to be due December 1st. We're not running a proposal at our regional center because it's something that we already have, but we're very pleased to be bringing it statewide. Thank you all for joining us here today. Thank you for our presenters. And thank you for Shift Care for coming, for Michelle for that great QIP information. We will send that out to everyone via email, but I hope everyone has a happy Halloween. And if you're in the office, there's free pizza, so you better go run down to the break rooms. So, all right, we'll talk to you later. Bye.